Dr. Randy Gross, and I'm a recent graduate here from the PhD in Nursing Science program at the Graduate Center of the City University of New York. And when the call came for great minds in nursing, the thought leaders, immediately came to you. And so I'm going to ask you to tell me who you are and about your career trajectory.
Okay, well, thank you, Randy. I'm Dr. Donna Nickitas. I am currently the Executive Officer for the PhD program in nursing at the Graduate Center, as well as a full professor of nursing at Hunter Bellevue School of Nursing. I've been at the Graduate Center since 2006 when the program opened, and moved into the role of Executive Officer in 2013. It's interesting that you asked this question about my career, because I knew very early on when I was a young girl, probably around the age of 14, that I wanted to be a nurse.
Really?
Yeah. I wanted to make a difference in the world, and I wanted to touch people's lives in unique and special ways. And one way I learned that is by being a volunteer in my community. Very early on, I worked with the American Red Cross, with the disaster relief, as a Red Cross volunteer. And then in high school, I had the opportunity to come to St. Vincent's in Manhattan to work as a Vincentine, which was a program
I love that.
for high school students. And I was exposed to nurses and nursing for about 3 or 4 years in my high school years, and I went right through, and at the completion of that, I knew that that's what I really wanted to do. That was my destiny. My role model was Florence Nightingale. I wanted to touch individuals, families, and communities. So right after graduation, I went into nursing school, an associate degree program in New York. And at that time, upon graduation, I knew it was my beginning. And one of my faculty members said, don't stop here, continue. She expressed the importance of education. So I went immediately on to a baccalaureate program at the State University of New York at Stony Brook. And upon graduation, I decided I wanted to see the world. And so I thought if I joined the United States Air Force that I would be given that opportunity. So this young girl who grew up in an Italian-American family left her roots in Brooklyn and moved to South Dakota. Rapid City, South Dakota.
Very different.
Very different. So as a young baccalaureate educated nurse, I was on a United States Air Force base in a small rural community in South Dakota. Very different from being in an large urban institution or a city into a smaller community. And I learned everything I needed, I thought, about leadership, command and control, collaboration, cooperation, teamwork, because of the structure that the military service offered us. So much so that I ended up staying 3 full years of active duty, leaving active duty and then coming to a full-time graduate program at New York University.
You're back in New York.
Back in New York, and continuing as a reservist. And I ended up retiring after 18 years of service. And I'll never forget that opportunity to understand, you take it for granted, how democracy makes a difference in people's lives, that you stand for the beliefs that patriotism provides to you in terms of your personal and national security. So, after serving in the Air Force and working in clinical practice for a number of years, I had an opportunity to start as an individual in a HRSA grant at Hunter College in nursing management, and that's when I first entered nursing education about 30 years ago. And I've been in education ever since. I never looked back.
So now then obviously you've had quite an impact over that time. And so in your observation, what do you see as the biggest issues that nursing and healthcare that we face, today now?
There were several.
Many,
There were
right.
several. I think first and foremost, I think all of us began to recognize that after we had the passage of the Affordable Care Act in 2010, many more Americans were afforded health access, meaning through insurance they were able to avail themselves to health care that they many never had before. So we brought on close to 22 million Americans to health care. But what we learned from that experience is the determinants, the social determinants of health that make a difference. Your level of education, your income, and where you live impact your health and well-being. And so with the Robert Wood Johnson Foundation new initiative of building a culture of health, we're beginning to realize that where you live does determine your health outcomes. Certainly clean water, clean air, safe communities, free of violence, that are supported with adequate support for education, lifts all of us. And so as nurses, the things that I think that we're faced with is morbidity and mortality of individuals' lives, their quality of life, dealing with chronic disease and conditions that will ensure that all of us live safe and secure lives. And the way to do that is to ensure that people have access to quality health care services. So when we do that, we reach individuals where they live, work, and play. That's a real challenge. And the other issue, of course, having just completed a doctoral program, you recognize the importance of the one level of education. So we still have a variety of venues to enter nursing education, but at the end of the day, we realize that baccalaureate education is where we want all nurses to begin. Exactly. And have an opportunity to experience so that they can go on and have an advanced degree, whether as a practitioner, nurse practitioner, a nurse midwife, a nurse anesthetist, clinical nurse, specialist, or in your case, as a nurse scientist. And we have to afford those advanced levels of education so that we build the pipeline, both in terms of the workforce and obviously in terms of nurse educators who can prepare that workforce.
You say nurse scientist. I said that for the first time this past weekend in DC. I was talking to some women in line at Starbucks. I said, they were marching. I said, I'm a nurse scientist.
There you go, absolutely.
So that leads into access and equity for care, the social determinants of health, and then clearly nursing education. Those are the things that you see. So now where do you see your legacy? You've contributed so much to nursing throughout your professional life. What is your legacy now, where you're going? Or what have you done for nursing?
Well, I think I have contributed in a variety of capacities. Certainly, predominantly in my role as an educator. I educated the next generation of nurse leaders and scientists within this role.
I am one.
Certainly as an author, where I have distributed and disseminated not only books and chapters in books, but through my peer-reviewed publications in my work in nursing research. Predominantly my research has been in nursing education, whether it's been through looking at venues of preparing undergraduate students working in nursing, working in service learning, or in peer mentoring, or in health policy. That's been my area of interest, and continue to do that. I also think as an editor, I get this opportunity to use my words to change the world and to influence the world so that others can learn from it. And I think that's a key contribution, because your words were left in perpetuity forever.
You have an editorial every issue.
Exactly. I'm the editor of Nursing Economics, the Journal for Nurse Care Leaders, and I think it's important that we encourage individuals not just to get terminal degrees, but when they graduate from their programs and continue on their journey, whether it's at the bedside or in the classroom, that they share and disseminate that which they're learning and sharing with one another. So I take the legacy issue really critically. I think it's important.
I agree. I do.
And I think sitting here and role modeling and sharing and preparing, that's what leaders do. They guide, they protect, they ensure, but they advocate not just for themselves and for others, but that others come to appreciate the work that nurses do wherever they find them, and that we share that work with others.
And I think that's for my own personal opinion, that's a core belief or a core value of this program, which I definitely take with me as I graduate. So as going into that, so the last thing I'm going to ask is, what advice do you have for today's nurses and the future nurses who are coming up and will come up after? Yeah.
I think that's a great question. I think the opportunity to sit and reflect, what would you say to the next generation? Well, I'm looking at it right now. And I would say, be bold, be brave, and do not be silent. This is a time where we need to use nursing's voice and nursing's values to ensure that we hold our elected representatives accountable to society at large and the world. And we can do that locally, regionally, and globally. We know that through the work of the internet and social media, we're that much closer. There's no borders.
Okay.
And so we should take every opportunity. And I know that I do, that whatever I do, I make sure that it's the best, that I'm impeccable, and that I live by the moral and ethical code of conduct of my profession as a registered nurse. And so that when I speak, I choose my words wisely, and I would advise that of those moving forward, certainly nurse leaders and nurse scientists, that what you're doing is representative of the profession, and that you want to make sure that the evidence that you provide to inform both the public at large and the profession is held to the greatest integrity and truth. And that's very important. And so I think, being a role model, ensuring that we're trustworthy, that we're transparent. And I think the public indeed knows that about us, but we have to believe that about ourselves.
Using our voice.
That's right.
Thank you. I love that, Dr. Nickitas. Be bold and use our voice. Thank you very much.
My pleasure.